Seanad or McCarthy.
Éireann, thank you, Leader. This morning I just want to take a few moments to talk about an extraordinary service that is based in Éireann Street in Dublin, and it's called Safetynet Primary Care. They also have a homeless outreach team, and the whole thing is led by a small team, Christy, Nicole, Larry and Seanad. But through their partnership with the likes of Tiglin, with Simon, we're seeing something very powerful in action every night of the week, and that's healthcare going to the most vulnerable in our society. If you look at the collaboration, it means that medical care if it's combined with practical social support, music, chiropody, bingo, everything all together, it ensures people that are experiencing homelessness can access joined up services in just one location. So with us every day in the cafe on Pearse Street, we're seeing people struggling with addiction, people whose health has deteriorated because they simply cannot access mainstream services. For many of them, even walking into a GP looking for help, the paperwork, all of that is just not straightforward. Barriers of trust, language in some cases, and simply the chaos of homelessness, Leader, it makes it impossible. But what Safetynet does is removes all of those barriers, and they bring doctors, nurses I know with Tiglin, they pull up in a mobile ambulance outside, and they have the doctors, the nurses and medical support, and it goes directly to the most vulnerable people where they feel safe, and they're treated with dignity, with compassion, and of course without judgment. So what I want to make sure is that when we can adapt these services to people living on the margins, we actually recognise that the service users that we're dealing with are living in very unstable conditions or, as I mentioned, chaotic circumstances, and reducing barriers to medical care is what is making the difference, and it makes healthcare accessible to those most in need. Last year alone, Safetynet delivered 6,000 patient consultations, medical interventions to homeless adults and children, and these are some of the most marginalised people in Ireland. And I see that impact every day with Tiglin, and you see chronic illnesses being finally managed, people being connected back into the healthcare system who are otherwise on the margins. So it's preventative healthcare at its very best. So, Leader, I welcome the opportunity just to show what wonderful services are out there, the likes of Safetynet, and more importantly, to make sure that services like that continue to receive the support and so that they can expand. Because when healthcare reaches those that are on the margins of society, it treats more than an illness, it restores the dignity, the hope, and it helps the chance of recovery. And in my view, that's exactly the type of society that we need to build. So thank you, Leader. Thank you, Éireann.